speaker this morning is Anne Marie Cook. Anne Marie Cook is president and CEO of Lifespan of Greater Rochester. She has been at Lifespan for over 28 years. She is the chair of the Monroe County Council for Elders and serves as co-chair of the New York State Coalition on Elder Abuse. She is a member of the stakeholders group for the New York State Master Plan on Aging and chairs several work groups for the Master Plan on Aging. So without further ado, I'd like to welcome our first speaker for today, Anne Marie Cook.
Here, I want to, excuse me, thank you so much, and thank Laura for inviting me to this conference. And, you know, I think I'm going to start off by just saying, why do we need a master plan? And I'm going to focus today on really the changing demographics, not only locally, but nationally, talk about other states' master plans on aging, certainly bring it down to New York, and of course, our area of New York, upstate New York here, and of course, the work of the master plan to date, our timeline, and certainly our challenges. Why a master plan? I feel like it's so obvious to most people, but most people don't focus on the demographics like we do. That's why I love talking to the choir here. Think about these statistics, even though for many of us, we know this, the national population over the age of 65 more than doubled between 1980 and 2020. And 2/3 of that growth occurred since 2000. And think about this, the 65 and older group grew by more than 59% during that time frame. Never before have so many people lived for so long. And not only are we looking at this, obviously, right now here in New York, but they're looking at it in the world. If I can do this, I'll play this short video here from AARP if it allows me to, just kind of a world view. And it's not showing up on your screen, so we're going to forget that and move on here. If I can get it later, I will. But suffice it to say that every industry is going to be affected by the aging of the population. As Pat Conroy said, he's an author, and this creates tremendous opportunities and tremendous challenges. But since I'm talking about demographics, let me just start right at the beginning. For most of human history, the average life expectancy was 18 years of age. Yes, 18 years of age. And by the year 1900, the average life expectancy was 47. So our field of aging didn't even exist. Most people didn't live that long. Of course, some did, but the average life expectancy was 47. So many things happened, of course, as we all know, from 1900 till today. We had heating and cooling, we have increased medical advances, but you know what? The other thing that happened were the boomers. Those individuals born between 1946 and 1964, this huge cohort of people, as we know, have changed every life stage as they have worked through it, and now they are in the older adult cohort here, and it's 76 million people, 10,000 people a day in the US turn 65. We know those stats, but they are startling. And they are the reason. Why do we need a master plan? Once again, I will say, because there are so many older adults. There are more than 57 million Americans 65 and older, and expected to go to 80 million by 2040. I put this graph to see, you know, we're in the middle of this 10-year period of time where it goes to 56, 57 to 72 million. But as the previous slide said, but then goes to 80 million by 2040. It's just not that far away to have all of these older people in the country. But I think one of the most startling things we have to look at too, for the first time ever in US history, the first time ever, older adults will soon outnumber children, less than 10-year time frame. This is from the US Census. And it just has incredible policy implications when we have so many older adults and not the children or the workforce behind them. So there's a lot of, I think, thoughts and processes we need to do, and certainly policy changes. Kind of the first step, our own Senator Kirsten Gillibrand, partnered with U.S. Senator Bob Casey from Pennsylvania to introduce the Strategic Plan on Aging Act. And essentially what it does is put money under the Older Americans Act for people to develop and implement statewide plans on aging and really create a guide policy and investments. You know, what kind of investments we need to support older adults so that they can live in the community or in the setting of their choice. And so it's kind of groundbreaking legislation. We'll follow that for folks. And here are the 24 states. Of course, I put in bold our own state here that are in the process of either developing plans or implementing aging plans right now. And even the National Institute on Aging has put out briefs about what kind of research do we need in the short term and the long term about an aging population. To kind of help these 24 states as well as others, the SCAN Foundation from California has put out a pretty extensive document pamphlet about how to create statewide plans on aging. And they really said that they need kind of 5 different components. 1, decisive leadership. The governor and make sure the governor and the legislature is involved. As we will see in a few minutes, of course, it was an executive order here in New York that started our master plan on aging. A rationale for it. You know, I breezed through some of the statistics with this group because you know them so well, but is there a rationale to really devote those kind of resources toward aging? And how do we prioritize and look at data differently and the various needs that people have? Is the plan comprehensive? So when you're looking at what I'm saying, what New York is doing, think about these 5 things. Does it address financing and workforce and caregiver support, housing, transportation, case management, of course, and so much more? Stakeholder involvement, are consumers involved, older adults themselves, providers, policymakers, and then the 5th component they said is accountability. Are there timelines? Are there measurable outcomes? Can we see if the plan is actually working, or did we do all this work and have it sit on a shelf? So New York had, you know, this SCAN Foundation blueprint, plus there were 5 or 6 other states that started before we do, including California, which has done a lot with their plan before New York got started. But New York State, I'm sure the governor looked at this data. By 2030, it says 1 in 4 people will be age 60 or older. I'm going to show some New York State data, though. For rural communities, upstate, and certainly upstate in general, we tend to have a larger percentage of older adults than downstate. So the numbers are even more startling when you begin looking at upstate and downstate. Currently, there are 4.6 million people over the age of 60 in New York. I also want to add to that stat, there's 4.1 million family caregivers. So think about, you know, while they may not be over the age of 60, some of them are, some of them aren't. There's a lot of people that are involved in aging, and that New York State, of course, did this plan to recognize that people want to age in place. They want to age with dignity, and they have and we should give them the respect that they deserve. So this isn't the first time New York State has really looked at, should we do plans on aging? And in fact, New York State was the first state in the nation to be called out an age-friendly state. And New York State looked at AARPs, domains of livability. There are 8 domains, if you can see listed there, that one needs to address. And New York State had a plan to be an age-friendly state, still does have a plan, is being implemented. And the 8 domains of outdoor spaces and buildings, are they appropriate for older adults, easy access, things like that. The second domain is transportation. Are there transportation for options for people? Many people in rural New York, and certainly the suburbs, it's a car-dependent society. How do we get people from one place to there if they don't drive? Third aspect is housing, and especially affordable housing. 4th, social participation. Everybody wants to do that. 5, respect and social inclusion. 6, work and civic engagement. 7 communications, and finally 8 community and health services. So New York has been looking at this for quite some time and building this plan to be an age-friendly state, but it's not the only plan that the master plan builds on. We also have a New York State prevention agenda, a health across all policies agenda or report, the age-friendly health systems initiative, and many of the hospitals, especially upstate, are getting this designation. And the New York State Office for Aging actually has a plan on aging every 4 years. And so everyone looked at the culmination of all these reports before the master plan was even started. I talked about sort of the demographics, and certainly New York State has looked at that as we're looking at a master plan on aging. But I think for our purposes here, this graph too is startling to me too. So we look at the year 2020 and look at 2030. So we're right in the middle, really smack dab. Look at the percentage, the number of counties that have an older adult, percent of older adults and older. So I'm going down all the way down here, that the number of counties, of course, we have 62 counties in our state, that are roughly 2020, 9 counties in our state had a population of 30% of older. In 10 years' time, that will be 33, all of them upstate, most of them rural, or even 25 to 29. We are rapidly aging here. This is a New York State Office for Aging graph here. We are rapidly aging, and this is the time that we are aging. And of course, in rural New York too, aging faster, as I said, and even the median age of individuals in rural communities are aging pretty fast. A lot of ways to look at this. In the Finger Lakes region from 2015 to 2040, those under 65 will decrease in population by 10.5%, but look at the over 65, 33% increase, and of course, over the age of 85, 101.5% increase. So I think I've laid the groundwork. In the world, in this country, in New York State, in particular upstate and rural communities, we have a huge demographic shift. The second thing, I won't dive into it too much, though I do think it comes into play as we're developing recommendations. Never before have we seen so many older adults in poverty. Now, I'll give a stat for Rochester because I'm here in Rochester. Rochester has the second highest poverty rate of any city or county in the state. But I mean, it's certainly I hope you can see these dark kind of counties here. That has the highest percentage of poverty in older adults here. So the state is also not only aging, but those people who are aging are living in poverty in greater numbers. And here's from Common Ground Health here. It's really their data here in their catchment area. But as you can see, the dark green are older adults living in extreme poverty, less than $12,000 a year. It's hard to see, but the city of Rochester and Monroe County. But if you look at every single county in the Common Ground Health catchment area, every county has areas of older adult poverty. And in some counties, Yates County, Steuben, certainly the city of Rochester, Ontario County has severe older adult poverty. And I do think that comes into play when we're talking about recommendations to help older adults for the future. And something I think that we should focus on, maybe not today, but certainly as we're looking at some of these recommendations and building them, I think we have to look at that as we're moving forward. So let me finally move forward here to the master plan. In November of 2022, Governor Hochul issued an executive order calling for a master plan on aging in New York. She said we need a blueprint of strategies for government, the private sector, nonprofits to support older New Yorkers. She also said address the challenges related to communicating, coordinating with caregiving, long-term care finances, and innovative care that we can provide for older adults. And a huge challenge, I think, coordinate all state policies and programs in older adults and trying to do that in the master plan. And really with the goal of ensuring that older New Yorkers live fulfilling lives in good health with freedom, dignity, and independence to age in place for as long as possible. I think that's what we all want. The executive order did also acknowledge not only the challenges, I think, of aging, but also acknowledge that older adults, many older adults want to remain in New York, that older adults in general generate 63% of household income in the state. I don't have a bullet for this, but also 43% of taxes are collected by from older adults. So huge value. Also a value in terms of family caregiving. We know an estimate about $39 billion is the estimate of family caregivers providing care to their loved ones. They volunteer at greater numbers. So it did acknowledge the wonderful opportunities older adults bring to the state, and also said, but we also know there's increased healthcare utilization of older adults, and the long-term care system may not be able to support the sheer numbers of older adults coming forward unless we make some changes. Also mentioned that we need to build bridges, that, you know, each state agency has to begin to work together, not in their silos. This is huge, as everybody knows. Facilitate collaboration with all stakeholders, raise awareness of these demographics that you and I can rattle off at any time, in any meeting, in any presentation, but believe it or not, a lot of people don't know them. So I am committed in every presentation to starting with them. Create academic research and other partnerships about aging. And certainly a few slides back, I showed you even the National Institute on Aging, of course, is really pushing additional research in aging and incorporate an aging and disability lens across state priorities. So as we're developing state priorities, really thinking about what's the impact to older adults and what's the impact to people with disabilities in this community. So the governor really did lay out a bold agenda, I will say, and things that need to be addressed. Factors impacting health that include transportation and housing. Many of us know today, because of other presentations, those health-related social needs or social determinants of health should be addressed. We should look at Medicaid and Medicare funding and what we need to do in the future to continue that funding. Meaningful choice and remaining in the community, how to support older adults in the community of their choice. Looking at healthcare services, which of course is overwhelming, I will say, is to look at what kind of healthcare system do we need in the future, the workforce challenges of that, and of course, how do we continue to support family caregivers? I had one stat that I used the other day in a different presentation that 15 years ago, older adults had 7 people they could call if they needed help. These included family, neighbors, church folks they went to church with, friends. And today that's down to 3 people. I mean, because families are more geographically dispersed, they're smaller in number. And of course, we don't know our neighbors and our family and friends the way we used to. So think about that. If 80% of all care today is provided by the family caregiver, and just a few short years ago, people knew 7 people, and today they know 3 people they can call. The incredible stress on the family caregivers that are left to care for individuals. So all this had to be covered in the master plan and is being covered in the governor's bold agenda. She said, you know, there's a whole bunch of things they also asked us to do, integrate the age-friendly work and the age-friendly health systems work into the master plan on aging. So looking at those 8 domains, plus the age-friendly health system, try to create a seamless system across settings, support and encourage public-private partnerships, ensure that our work is person-centered, that we address workforce issues, increase access to information about services and supports. I still maintain that's one of the biggest problems we have, and expand availability of services when needed. And the executive order really asked the Commissioner of Health from the Department of Health to chair it. the director of the State Office for Aging to vice chair it and create a stakeholder committee. And I am part of that stakeholder committee of the governor. And this is the structure for it. It is a bit overwhelming, not only on this slide, but I'm going to tell you in the work. So let me just dig a little bit deeper into this. There are 8 subcommittees that were created, and you can see them to address all of the concerns that the governor had or what she asked us to address in the executive order: long-term services and support, home and community-based services, formal caregivers, the workforce, informal caregivers, our family caregivers, safety, security, and technology, health and wellness, economic security, and finally, housing and community development and transportation, all tall orders, as you can see. And then there were some foundational pillars. I'll run through these quickly. Housing access, the informal caregivers, as you can see, a lot of it similar to the other slide: affordability, access, modernization of financial sustainability of healthcare in residential facilities, social engagement of older adults, promoting health and access to services, and supporting rural communities. So that's right in one of her pillars: combating elder abuse, ageism, and ableism, technology access, and prevention. So tall order once again. And of course, there has been a lot of cross-cutting themes that have emerged. We're looking at age-friendly policies. We've talked a lot about ageism and the problems of ageism, diversity, equity, inclusion, geography matters. You know, even as we're talking about in this rural health conference here, you know, it's much more difficult to get all of these services, obviously, in rural communities. Really, housing and affordable housing, person-centered models, ensuring that all services are welcoming to those of all sexual orientation and gender identities, social isolation, technology, training and education, transportation, workforce, and of course, funding. So how did all this get started? The stakeholders group started and also started with community listening sessions. There have been community listening sessions in all 5 boroughs: Rochester, Buffalo, Westchester, Long Island, Utica, Binghamton, Syracuse, Plattsburgh, and Albany. And I think there's another listening session next week in Buffalo, really having older adults explain to the governor's staff some of the concerns and issues that they have. Once we began our work, the stakeholders, you know, came together. We created those subcommittees that I listed there and work groups. I'll go through the work groups, but there was a preliminary report that was done in August of 2023. At that point, in August of 2023, there were 351 members working on the master plan. They convened 309 meetings, 5 state agency council meetings. So all of the state agencies coming together to talk about aging and the recommendations, 5 stakeholder advisory, that's the committee that I'm on, 36 subcommittees, and 263 work groups. So what are the work groups? You know, I talked about the subcommittees. The first one I'll go through is housing, community development, and transportation. Then underneath it, there was a work group for each one of these dots here underneath each one of these subcommittees: housing, community planning, transportation. Under formal caregivers, recruitment and training, retention. I'm not going to read all these to you, but every single one of these dots underneath the larger subcommittee had a work group meeting. I mean, just an incredible amount of work that has been done on this. And you can see health and wellness and all of these different dots. So when you look at all this, there's 8 subcommittees, 33 work groups, 500 people providing input. They put out a survey across the states. 10,000 surveys were returned, but the New York State Office for Aging in their aging plan also surveyed folks and had an additional 27,000 providing input. There have been 650 meetings, roundtables, and town hall meetings. So an incredible amount of work, I would say, that has gone into getting all of this information. As all of us know that have done strategic planning, no, there's no way that you can have all of this input and actually do all this work in this next 10-year period of time without sifting through it, trying to figure out priorities. What are we going to focus on? How do you get everybody focusing on that? And so that hard work is being done today. So what has happened here now is really in late 2022, early 23, you can see the timeline here. The governor's folks established the state agency council, our stakeholder advisory committee, and all these subcommittees. They developed a work group and put out that preliminary report that I just talked about a few minutes ago, just looking at all the work that has been done to date and some of the discussion that has been talked about. They've continued all of these public forums across New York State, and they say they did not make this a draft of the final report. This timeline says early 2024. That draft of the final report is still not out yet. That we're anticipating July or August, and then the stakeholder group will meet again to do some final tweaks, and then in early 2025 is supposed to be the absolute final report and the adoption of the Master Plan on Aging in New York. It's a lot of work. Now, I will have to say to you that some other states here have taken their master plan and done tremendous work with it. I think that in California, they did master plan. They're several years ahead of us, and the governor has committed to $2 billion over a 10-year period of time to address some of the needs of older adults. And I will also have to tell you, I think that there's been a lot of challenges as the master plan's been developed. And I think the governor's staff has acknowledged those challenges, but it's one of those things where it's difficult to talk about 10 years in the future when you're struggling today. So let me talk about today. There's about 16 to 18,000 older New Yorkers that are waiting for services such as Meals on Wheels or transportation or case management. And during these discussions of the subcommittees and the work groups, I think there's been an incredible frustration from folks who provide direct services saying, we can't think 10 years out in the future or even 5 years out in the future when we can't serve people today. And certainly the state budget, I will say, did not address this waiting list issue, causing a lot of frustration among the providers. Second challenge, I think, is long-term care. Certainly those folks who are in the healthcare system can attest to the fact that our hospitals, especially the hospital upstate, are under extreme stress right now because we cannot get folks out of the hospital into nursing homes and into rehab right now. I mean, it is really most of the folks, certainly in the Rochester community, or I would say a lot of the folks are going to other rehab facilities outside the Rochester area because there are no beds. In our region, the 9-county region around Monroe County, there's 1,000 nursing home beds that are currently closed right now because of workforce shortage issues. This has been talked about. Once again, once you're living kind of this immediate crisis need, it's hard to look in the future. But we also know that the cost of long-term care, Medicaid has not kept up. And certainly providers are saying we're going to reduce beds unless we can get paid, and certainly the availability. The third challenge that I think all of us have seen in this immediate need right now is workforce shortages. I talked about it in long-term care, but in all honesty, as we all know, it really spans across every industry, the nonprofit community, healthcare, long-term care. So building this plan and wondering how are we going to address some of these issues when there's not a workforce right now to support it has been difficult. Next challenge, ageism. We've had a lot of discussion about the negative impacts of ageism. had some great discussion about research that has been done about what happens to older adults when they inculcate those negative images of being old. And how do we combat that? So good discussion there. I mean, the fourth one, certainly a disconnected system. And we talked about a disconnected system on so many levels, that state agencies work in their own silos, that healthcare works in their silo, that community-based services works in their silo. And it's very difficult, quite frankly, to jump silos and really serve the whole person. But I think it's been some great discussion about how can we do that. Hopefully spurred on a little bit by the 1115 Medicaid waiver, who also asked, us in that waiver to address social determinants of health or health-related social needs. And I think the biggest challenge is cost. I was on a webinar yesterday, even with, there was a bunch of elected officials talking about aging and talking about long-term care. And they said, we understand that there's a lot more older adults. We understand the long-term care system is suffering, but where do we get the money to do it? Was the answer, or at least what they said in that webinar. So I think, as we try to reach for the governor's desire to have all older New Yorkers age with dignity, age in their community, and age with independence, we have a big challenges ahead. I'm watching on TV right now, full disclosure, the Ben Franklin TV series here, but so I grabbed a quote from Ben Franklin by saying, by failing to prepare, you are preparing to fail. We know these demographics. I mean, they're not new to anybody on this call. They're dramatic and they're real. I mean, and we also know the increase in poverty of older adults, which causes more challenges. We also know that the middle class really struggles the most. They don't have money to pay for services, and they don't get the Medicaid services. So I think the plan, honestly, it is a great time for the plan. I think we have a lot of challenges ahead. We've had an incredible amount of input into what older adults need. And now I think the difficult part is sifting that through and beginning to prioritize the recommendations. There are hundreds of recommendations underneath those 8 subcommittees, underneath those 33 work groups, hundreds of recommendations, but we know we can't implement all of them. And what I think the key question is, I love that picture of older adults and children, but what can we do? What can we do as a community? What can we do as an aging community, as a healthcare community, to help older adults thrive in the future? I look forward to sharing with you the final report when it comes out sometime in July or August. Happy to send that to Laura and Thera and get that out to folks for final comment so that we can finalize this plan in 2025, as everybody says, and begin implementing something that helps older adults really thrive in the future. Thank you.
Anne Marie, thank you so much. I see a lot of heart and thumbs up reactions. We do have, and more applause and thumbs up.
Oh, thank you.
Coming from the audience. I would encourage anyone on the call today to please put your questions for Anne Marie in the Q&A feature. Meanwhile, I do see that we have a question in the chat that I will read to you. It says, Anne Marie, do you see the state increasing the hourly wage / benefits for healthcare workers to promote more jobs?
I don't know how others feel. I don't know how you don't do it. If we're going to really prioritize older adults in this state and look at not only their value, we talked a little bit about that, the tax base that they provide. I think we've so devalued the workforce, the helping workforce on so many levels, both healthcare as well as human services. This is part of the reason why we're in this crisis we are today. And I know it's like a Titanic, moving the Titanic in a bathtub or whatever that saying is. But, years ago, Governor Cuomo said, fast food workers should make more. And all of a sudden that became a state priority. And right then, I don't know about you all, but I cringed at that. Like, how could you, prioritize fast food workers over healthcare workers or folks working in human services? But he did. And we have the ability to do that now, and we have to. I mean, I see the crisis every day, and I am not exaggerating when I say I get 5 or 6 calls a week from people who have their loved one in a hospital trying to get out. And I've had multiple people call recently because no one's gotten a bed in Monroe County, and people are upset. They can't stand, what's happening and don't know what to do about it. And that's our problem collectively to solve.
Thank you for that. It looks like we do have an additional question in the Q&A. And again, I would encourage anyone on the call today, we do have time to take additional questions or comments for Anne Marie. You can put them in the chat, but I'm probably more likely to see them quickly if you use the Q&A. So let's see. So Anne Marie, there's a question. Is there a place for employing recent immigrants as paid caregivers?
It's my understanding, and someone can correct me if I'm wrong, the problem with sort of the new Americans and asylum seekers now is that they haven't gotten their papers to be to join the workforce. There's some hang up, I believe, at the federal level that I don't quite understand, so I'm not even going to talk about it. But I do firmly believe that the new Americans are part of the solution to our workforce shortage issue. I always tell this story, and I hope you don't mind if I tell it again. My parents are immigrants, and my aunt came after my father came here, and she really wanted to be a nurse, and she lived at Monroe Community Hospital. She lived there so she could get her training, and that's how it worked back then. I don't even know all the particulars, but she got her training there. They worked right there at Monroe Community Hospital, and then of course she got her nursing degree. And I keep wondering, if we should go back and look at some of those previous models about how we trained healthcare workers. And when you look at new Americans here, some of those individuals may want to do the same things that happened years and years ago to immigrants that came to this country to help with the workforce shortage. And I think they're part of the answer, not the whole answer. I also think it's wages. I think it's a whole lot of other things, good working conditions. But we have to figure out on a federal level, it's a great question to ask sort of our federal legislators, what is going on and why is there such a holdup in giving people their working papers so they can begin that process? And as we all know, I mean, there's language barriers too. So there's a lot of training that needs to go on. The longer that we delay letting these new Americans work, the longer it will be, quite frankly, before we can get them in the workforce and helping solve, at least in part, this issue.
Thank you. Thank you for that question and also for that very comprehensive answer. I saw a lot of hearts popping up. I would encourage, I did see that someone had their hand up. If you have your hand up to add a question, if you could please put it in the Q&A. We are in a webinar format today, so we don't have the ability to call on people with hands up, but we'd love to hear from you through the chat or through the Q&A. And we do have a few more questions, Anne Marie, that have popped up here for you. Let's see. There are 2 questions from this person. I'd appreciate hearing about what the state and counties are beginning to do now to address some of the immediate known issues while the master plan is finalizing. Does this group have a good place to stay up to date on those activities and services?
Yeah, I'll take the master plan question first. There is a website that underneath the New York State Department of Health, if you Google it, Master Plan on Aging, and really a lot of the information I talked about today is listed under that website. It also gives you that preliminary report that was issued last year. So you can see under each work group, under each area, some of the things that have been talked about. So that's a great resource to go to in terms of the master plan. In terms of the counties, years ago, I mentioned the New York State age-friendly plan, but as many counties in New York, and it really started upstate, started in the rural communities, began doing an age-friendly plan. I think Chemung County, someone can correct me, was one of the first counties that did an age-friendly plan, looking at those 8 domains of livability that AARP has put out in the World Health Organization, looking at each one and devising a plan, honestly, to make people not only more age-friendly, but really live-friendly. Everything that we do in aging really helps the entire community. So I think we have to go back to those plans as we look at the master plan on aging and see some of the components of those plans, and see how they can influence and address some of the issues to create age-friendly communities.
Thank you, Anne Marie. And thank you, Beth Stranges. We see you there. And Chemung says, yes, Chemung County was the first to develop this plan.
Yeah.
So appreciate that. So the second part of that question is, where might someone find more about careers in this space? I don't have a master's, but believe I and others could help by moving our own careers into this space.
Yeah, awesome. I mean, whether it's healthcare or whether it is aging and offices for aging, or whether it's nonprofits like Lifespan and Aging, honestly, we need you. I will say apply. We don't need a master's degree for many different jobs. Some you do, but many you don't. And what you need is really to be trained in aging and help people age in place. I have focused a lot here at Lifespan too about coordinating with other systems. And I have to say, I've learned a lot, most of it painful, because it is very hard to integrate with healthcare when you're an aging service provider. It is very hard for true integration of looking at the whole family unit. I also think it's difficult on so many levels to look at the needs of the older adult and the needs of caregivers and trying to make sure that that family unit works together. And I've had my own personal experiences, and I use those experiences as I'm trying to figure out how do we bring more people into the workforce, and how do we make sure that everyone's working in the same direction here to help older adults? I guess it's a long answer to say we need you. If you want to work in aging, give me a call. I'd love to talk and love to, if I can't offer you anything at Lifespan, please direct you. I could be happy to direct you on some other options. We need a strong workforce in aging. There is no question about it. And we need all ages working on this.
Thank you for that. I'm going to pull the next question from the chat. It says, Anne Marie, you have worked on many master plans and senior action plans over the years. What gives you the optimism that this plan will make a significant difference?
I'm already using it. I'm going to tell you, because all of us need to use. My optimism is because I work with some great people that can use this already. And I was optimistic looking at the subcommittees, because when I looked at the workforce issues or family caregivers or elder abuse, I've spent a lot of time even on the master plan working on elder abuse or transportation, housing. I thought, okay, they nailed the subcommittee titles correctly. Now, the work has been difficult, and many of you on this webinar probably are on some of the work groups. I mean, it is difficult to develop these recommendations, but I have found it also stimulating, I have to say, of thinking about these issues, reading, researching some things that have worked. And so I'm going to take those subcommittee titles and say, yeah, I think that that's the right direction we need to be talking about to help support older adults in the community. I think the hard part is really getting the legislature and the governor to put some real money behind it. So I'm going to challenge all of you, and I hope that you take me up on this. I really think we need to make 2025 the year of the older adult. We're not going to have hundreds of people around the state working on this master plan and really have a state budget that was disappointing at best. I don't want to bash anybody, but I could not believe from not only the health, long-term care side, but also the aging service side, how disappointing this budget was. So I want all of us, quite frankly, to say, okay, you created an executive order for a master plan on aging. That's unusual. You convened hundreds of people to give input. You had town hall meetings from Long Island to Niagara Falls and everywhere in between. Not enough rural, though, if you looked at the map on that. Giving input. Thousands of people really at the end have provided input, and now you need to put your money where your mouth is. And I think all of us need to develop an advocacy plan together. And this will be hard, but happy to lead that charge. So all of us go to Albany or our elected officials or in their district offices and say, okay, we have to start here. We have to start where 2025 is the year of the older adult, and not only capitalize on the opportunities of an aging society, but also address some of those challenges so that people can stay at home. So you'll hear from me.
Thank you, Anne Marie. I love it. 2025, the year of the older adult, and put your money where your mouth is. And
That's
you'll
right.
see, if you can see the reactions from the audience and in the chat, lots of hearts and thumbs up in agreement. So thank you for that. We do have several more questions, so I'm going to continue. The next one is, good morning. I am a nurse in Monroe County that does private elder care in clients' homes. Huge need for more private care in homes since COVID. Where can I recommend other caregivers to go for local training so they are prepared to provide in-home care?
Yeah, it's a great question. The New York State Office for Aging does have some videotapes, of how to do the basics, transferring with, things like that. Pre-COVID, there were in-person trainings about how you help an older adult with all the care needs they need. And, as you were reading the question, I'm like, but I don't know if they still exist today, but I will find out and tell Thera and Laura to get that information out.
Thank you. The next question is, Anne Marie, is it possible to rehab the entitlement system to allow and support those individuals who are able-bodied to work to receive supplemental income that ensures they can maintain transportation apart from their pay?
Yeah, I wonder if are you talking about the, like, Social Security? I don't know if I
Yeah,
understand the question. Tara,
I
maybe
think,
you can help me.
no, I think we do need a little clarity, so I will do this. I'll ask Emma to please just put a little more information in either the Q&A and the chat, and we'll move on to another question. The New York Health Act is legislation that would provide universal health care for all New Yorkers and would cover long-term care. Senate Bill 55474 and Assembly Bill, I believe that was Senate Bill S 5474 and Assembly Bill A 04738. This bill is supported by Senator Gus Rivera of the Bronx and Assemblywoman Amy Paulin. Why no discussion of this?
I think cost, Senator Rivera was on the webinar I talked about yesterday. I mean, he seems frustrated that there's not the funding that he feels is necessary to go to many of these health issues. And I'm sure that bill, I know a little bit about it. So I think we have to figure out how to pay for it. I mean, there has been some discussion in the master plan about what some other states have done. Most people have kind of shot down the ideas, but one idea I think we should talk about too is Washington State 10 years ago had a small tax for every working person to provide long-term care. They didn't utilize this fund for 10 years so that it would grow. And now folks in Washington State, if they need long-term care, have a pot of money after they qualify that they can use for either in-home services or a facility base. There's a lot of reasons why people said it wouldn't work in New York, although, I like talking about different ideas so that it spurs people's thought process. And I think this bill provides universal health care, doesn't it? it may provide, if I'm right, if I'm thinking about the right bill, universal health care, and as we all know, there's a lot of opposition from the insurance companies about that.
Okay, up next, and this is more of a comment, but I wanted to make sure that you heard it, Anne Marie. Thank you for everything you are doing to advocate for this cause. It is evident how passionate you are about caring for our aging population in New York. I feel much more aware of the concerns facing our aging population by listening to your presentation today.
Oh, thank you.
Okay, and now we'll put you back on the hot seat. Okay. Has Lifespan looked into why so many folks are being placed into the out-of-area SNFs, or skilled nursing facilities? One of the challenges that I deal with is the Medicare HMOs dictating and cutting folks prematurely because they do not meet their unrealistic algorithms. We also cannot manage mental health and behavior challenges due to progressive dementia. Are any of those work groups focusing on these specific challenges?
To be honest with you, yes, I have. I will say yes. I have talked to all the hospitals, talked to certainly the nursing home folks about the issue. We're in a crisis. I mean, there's no question here in Rochester, we're in a crisis. So let me say that. I think part of it is workforce shortage. Part of it is the poor reimbursement by Medicaid. And the nursing homes are not utilizing all the beds. Like I said, in any given day, you could have 1,000 beds closed here in this region, causing huge issues. Now, what was the second part of that question? Now I forgot, and that's what I was trying to get to.
Let's see if I can find it.
I'm sorry.
No, you don't need to be sorry. It saves it.
Oh, I think it was, has the master plan addressed this? The
Any
answer is
work group.
The answer is no, interestingly enough, and I think it's a huge issue and a huge crisis. Now, I did, talk to Senator Cooney the other day, because a couple of years ago in the legislature passed, and it was signed by Governor Cuomo to create a reimagining long-term care task force in New York State. Really pre all this stuff, even pre-COVID, this task force was supposed to develop, because everyone saw the problem, that long-term care can't keep up and funding it can't keep up. It was never convened. And I said to Senator Cooney, what are we all waiting for? We're in a crisis in long-term care. We need to figure out how we appropriately care for people. Before COVID, I always heard about these quality task forces that were happening, looking at long-term care and the culture change kind of concepts and all the things the Pioneer Network promote. And I never hear about that today. Today, it's just trying to get people just actually in a bed. And I'm hoping we get back to the time when we're actually not only talking about we have enough space for people, but quality services. I think we're in a very rough time. I hope the state begins to address long-term care, but in a lot of ways, it has not been addressed in the master plan.
Thank you. And I apologize if this has already been answered. It may just be worded a little bit differently in this question, so please let me know. Anne Marie, don't you think any master plan on aging should include supporting the New York Health Act?
I think it should. I think it should, or at least be discussed. I think it's controversial, so I'm not sure it'll be included.
Thank you. So we have a follow-up question from Emma, who asked about benefits.
Oh, yeah.
Thank you, Emma. She was speaking of the public assistance type benefits of which individuals receive. When employed, they lose those benefits. If there could be incentives put in place that would allow individuals to remain in the workforce and receive supplements as necessary from the entitlement systems. Sometimes, for example, it may be an additional $200 a month to supplement their employment income and ensure the continued participation in the workforce. As you stated, this and statistics show we are in dire need of people in the workforce, especially for the aging.
Yeah, now I understand, Emma. Thanks so much. The benefits cliff. It is really huge when you think about the benefits cliff, and there's a great little clip or a little video that I saw about this that really explains it well. So Emma, contact me, I'll send you that. But you're absolutely right about this benefits cliff, and it impacts a lot of the workforce, in which people are saying, I can't work more. I love to work more hours, but I can't work more hours because then I'll make too much. I'll lose Medicaid. I'll lose some of the benefits that keep me stable in the community. Years and years ago. See, this is what happens when you've been around as long as I have. I can remember a program they started to do called the CAP program, and I can't even remember what the acronym stands for now, but was a program to test whether gradually reducing your benefits over the time would help people on this benefits cliff that you're talking about. And to make a long story short, we switched governors and that program was ended. They didn't even really get it off the ground. And I think it's a great idea. And yes, I think the benefits cliff is real. I think it hurts the workforce from working more. And it certainly makes no sense to work more if you can't equal the benefits you're going to lose. So Emma, contact me, please, if you'd like to see that little clip. But you're actually absolutely right that that's a huge issue right now when we need more people in the workforce.
Okay, great question. Thanks again, Emma, and thank you, Anne Marie. So we have a couple minutes left before we take our first break. Thoughts on the changes to our payment systems, MCR, and how it has affected aging in place and how we manage care for our aging population in the home. I find less referrals for home OT, which is an issue with aging in place, in my opinion.
Yeah, I'm going to say I don't know too much about it, but I've heard that there's less referrals for home ET. I think it's a reimbursement issue that some of the home care agencies have reduced what I heard, PT and OT, because they can't get reimbursed to meet their costs. I don't know it enough to talk about it, but hopefully one of the other panelists later on will know more than I know.
Great, thank you. Okay, a couple more. How do the changes for CDPAS or CDPAS help rural areas when there is no PCA available? Many people in rural areas will not be able to get aid service due to changes with CDPAS. How will this be addressed?
Yeah, I cannot believe that the changes down to one fiscal intermediary that occurred in this state budget. I can't imagine how they're even going to implement this, quite frankly. And for rural communities, the CDPAS program is critical. I mean, there just isn't the workforce unless you have the CDPAS program. And while, of course, there was probably some fraud, there's fraud in every program. I think that the state went way overboard and way overemphasized the fraud versus the workforce problem that this change will happen. So I don't even know if the state understands how they're going to get from what it is today down to one fiscal intermediary. I think it'll take years. I think it'll be stalled. And because we need this program too. I mean, there's just no way to care for people.
Thank you, Anne Marie. I'm going to ask you one last question. Thank you so much for hanging in there and answering all of these questions. And thank you to the audience for being so engaged and supplying them. We really appreciate the feedback and the questions. This last question is from Erica. I am the director of the guardianship program and having to advocate for a number of people placed in rehab centers and nursing homes for people with complex medical needs. The people with lived experiences with disabilities also have special needs such as ventilators, feeding tubes, and wound care. We are in desperate need for more residential programs or communities that can appropriately care for all individuals.
Totally agree. Yeah, and guardianship, of course, poses, a tremendous responsibility on the individual to make sure that care is appropriate. And when care is not there, it is very difficult to advocate. So I feel your pain. We also do guardianship services here at Lifespan and, are constantly advocating on behalf of not only all the clients we serve, but certainly our guardianship clients who we know can't advocate for themselves.
Okay. We are just about to 9:35. Anne Marie, I want to thank you so much for being with us today, for your presentation, and for taking the time to answer our questions. We're getting all kinds of thumbs up and hearts and applause and wonderful feedback in the chat. So thank you so much. And I hope you enjoy the rest of your Friday. For our audience, we are going to take our first break. So get up, stretch, grab another cup of coffee, and we will meet you back here at 9:40, and I'll introduce our next presenter. Thanks
Thank you,
again.
Tara.